been in Baltimore for about 5 months. Some of the procedures I've been through are a stomach surgery to take out the tumor in the front, and a back surgery to take out the tumor in the spine. I've also had a femoral osteotomy to shorten my femur so my legs can straighten.
When I first met Rod in the clinic, he was in a wheelchair. He was on very heavy pain medications. He was very sedated on heavy pain medication. And anything I did in terms of rousing him to ask him questions or to try to do a physical exam was met with him moaning in pain.
I had been looking for answers since he was about 3 years old. He used to complain about his right leg hurting, but it wouldn't be anything like that would just make you say, oh my God, something's wrong. It's just like he'll wake up, oh, my leg is hurting. Give him some Tylenol, he's fine. He goes on. Maybe 6 months down the road, he may say, oh, my leg is hurting. And then just over the years, it had gotten progressively worse. And I'll never forget one day, and I was getting all the kids up, getting them out to school, and Rod cannot get on the school bus. He just cannot lift his leg up to get on the bus. I took him to an orthopedic doctor, and he got diagnosed with having the Schwannoma tumor. He had surgery, I think it was 3 weeks later, to debulk his tumor, and that helped a lot with the pain. He went about 4 years it carried him. By the time he hit 5th grade, you could tell that it was growing. It was starting to protrude in the back and in the stomach. So we knew it was getting bad.
One of the reasons why we're here at Johns Hopkins today is because we were not able at home, Atlanta, Georgia, to get the type of treatment that we received here. We were told that no neurosurgeon should ever touch his tumor. That any neurosurgeon who would consider touching his tumor, we should turn and do an about face and run.
Roderick Ball's a really lovely 11-year-old gentleman who we met through email correspondence to begin with. His parents were getting rather desperate about what they were going to do with Roderick because he was having so much pain and he was losing function in his legs. About from the mid-thoracic level down through his low back and into his sacrum, the spinal canal was filled with tumor. And then the tumor was coming through the holes in the spine where normally the nerves come to feed the abdomen and feed the legs. Those holes on the right side are completely filled with tumor, and then the tumor extends into the right side of his abdomen.
Medical treatments had been tried, chemotherapy had been tried, previous surgery had been tried, and yet he was still worsening. And they could point to specific areas where he was losing function.
When you looked at his MRI, it was just devastating to look at the extent of tumor he had, both within the spine and then all through his abdomen. For Rod, we felt that there was a reasonable balance where we could get rid of, let's say, 70 to 80% of the tumor and yet still maintain normal function for him. One of the problems we face with him is where his leg is bent because he used to keep it that way because of the pain. But in keeping it that way, it became deformed and fixed in that position. So we've had to stretch his legs back out into the normal position, and that's been a real challenge. Dr. Sponseller from our orthopedic pediatric service has been able to do an operation to shorten the bone, lengthen the tendons, and allow the nerve to stretch a little bit as well so that he can get his legs into a straighter position. We'll probably use a series of casts as we gently straighten the leg back out. But that puts him into a functional position where he'll be walking.
My dad's routine is to come here for a few days and go back to Georgia to work. My mom, she stays here most of the time.
So having been here for going on 5 months, very difficult. We can now see the light at the end of the tunnel, which is I got to tell you, is quite gratifying. Today he had his cast cut, so he's now in PT and he's stretching out, and presumably he will be weight bearing, hopefully the end of this week. And so, yeah, I can't wait to be here to watch him take those first steps.
So now we're going to stand up just like before. See? It's just like before.
Rod, if I could think of one adjective, I would say resilient.
Press your knees back and bend your knees.
Has not once said, why me?
And press back.
He understands that he is here for a purpose, and that's to get himself better.
When we get a challenging case like a Rod Ball, we're able to put together a team that has clinical expertise in many different areas, who have research expertise, and who can bring the latest research that's going in the laboratory. We can bring it right to the patient in a very expeditious manner. There are very few centers that can do that and offer that to the patients.
It's a great feeling to know that we are, 90% through this thing. And we feel like we are going to continue, if it takes, twice a year, MRIs here at Johns Hopkins, follow up with the doctors here at Johns Hopkins, and continue his treatment here.
My parents, they always say, if you really want something, you've got to work at it. The pain it's pretty hard, but you're always going to get through it.
Woo!
It's definitely 100% better than what it was, just for Rod to be able to rest at night and not scream and excruciating pain and having to take him to the hospital just to get the pain under control. That's a blessing in itself. And for him to be able to be mobile again, to get up, if he wants something to eat, go get it. We know that we're doing the best thing for Rod, and that's just the goal of all of this.